Thank you very much, Karen. And I've got to say, it's a real pleasure to follow on from the talks we've had this afternoon, which I think demonstrate the rich tapestry, the range and diversity of work that we've got in the area of mental health. And I'm going to tentatively suggest that we make this an annual celebration and talk about the work that we do. But I'm going to talk about the prevention of mental ill health. And I think this is really important. And aside from working in the university, I work in the National Health Service. So sort of man and boy, I've been a doctor in the NHS. And I'm really proud of the NHS, and it's got health in the title, and I think that's a little bit of a misnomer, because what we tend to do is treat people further down the line. We're more a national sickness service, and I think we could spend more time thinking about how we might prevent the onset of disorders and how we might enable people to stay well. So it's with that in mind, I'm going to talk about our trial, our work in this area, which is the largest ever trial to prevent the onset of depression in older people. And this is a trial that's been conducted in the good county of Yorkshire. So this is a Yorkshire study for Yorkshire people. So here you go. Now, my grandma used to say, an ounce of prevention is worth a pound of cure. And I thought I'd better check that at the University of Wikipedia before I came over here. And it wasn't my grandma at all. It was Benjamin Franklin said this. And Benjamin Franklin was he was a polymath. He was an interesting guy. And he was the editor of the Pennsylvania Gazette. And he was bothered that his home city of Philadelphia was going to burn down. It was a wooden city, and this had happened to some early American cities. So he wrote a letter anonymously to his own newspaper, and he said, unless you have a fire service and unless you clean your chimneys once a year, the city of Philadelphia is going to burn to the ground. And it's better we try to prevent this happening than try and build a city from the ground up. So this is where the term, an ounce of prevention is worth a pound of cure, comes from. So there you go. Hopefully I've imparted some knowledge on you other than what I'm going to talk about, which is the CASPER study. Some people who contributed to the CASPER study are in the audience today. And this is about preventing the onset of depression amongst older people. And we've already heard that depression is really, really important. Depression's a serious problem, and it's really quite common amongst older people. And the problem is that it often gets dismissed as an inevitable consequence of growing old. And that's not the case at all, because it is a treatable disorder. And the NHS, I'm afraid to say, doesn't really respond well to the needs of older people with depression, where the vast majority of people present, and that's primary care, and it does very little about the prevention of depression amongst older people. And over on the left there, I've got a word cloud that demonstrates some of the important risk factors that we know about for depression in older people. So older people with long-term illnesses, older people who are lonely, older people who have chronic pain or have experienced life events or experienced physical frailty or poverty, or have experienced bereavement or are socially isolated, or at particular risk of developing a good growing dose of clinical depression, which is bad in lots and lots of ways. So our big idea was to see if we could target these people who were particularly at risk of depression and use some of the things that we know work for depression to see if we could prevent the onset of that disorder in this population. So rather than simply waiting for people to become depressed, can we use simple psychological approaches to prevent the onset of depression amongst older people? And this is a project that was funded by the National Institute of Health Research. So here's what we did. We took a very simple psychological intervention that we know quite a lot about. We are blessed to have an international expert in the use of behavioural activation, and it is Dr. David Eakers, just sat down there, a naturally modest man, but he helped us think about how we might adapt this intervention for older people with a load of the problems that I talked about previously, and particularly how we might use this to try and tackle avoidance. So older people with depression tend to withdraw into their homes. They stop interacting with the outside world, sometimes take to their bed, and how we might collaboratively reintroduce some of the rewarding activities that people have stopped doing. And we delivered this over 6 to 8 sessions, and the really revolutionary thing about this was that it was delivered with a very high-tech medium, via a high-tech medium, and that was the telephone. People didn't think that we'd be able to do this. So this is the largest ever trial conducted of this type in this area, the largest ever prevention trial in an at-risk population. And we recruited just north of 700 older people with lower severity symptoms indicative of a very high risk of developing depression in the next 12 months. And the average age of our participants was 77 years, and we didn't get any centenarians, but we did get someone in this trial who was 99 years old. And we delivered the intervention and we followed people up and compared them to people who received usual care from their general practitioner. And we measured the severity of depression and the quality of life. And one of the things we do really well here in York is we're really good at health economics. So the economists studied this population in a great level of detail to understand what the costs were of these people in the NHS and in their broader social environment and some of the consequences of experiencing depression. So what did we find? So I've got 3 findings for you here. I've told you this is a Yorkshire study for Yorkshire people, so I've preserved some Yorkshire dialects here. And she said, I thought it'd be odd talking over the phone about yourself, but it were all right. Very good. So they liked it. So the concurrent qualitative evaluation within this study pointed very strongly in the direction of this being an acceptable form of psychological intervention delivered through an innovative medium, which was the telephone, which meant that people didn't have to get buses or taxis to the hospital. And it seemed to be they liked the way in which that happened. Now, over on the right is a graph, and the graph shows, with usual care, when you follow these people up at 12 months, about 30% of the people had gone on to develop a good going case of depression that needed proper treatment. And if you look a little bit onto the left there, behavioural activation, the group of people who received behavioural activation, the proportion of people who went on to develop more severe depression was substantially lower, about 17% compared to 30% in the usual care group. So the magnitude of this difference and the number of people that we recruited to this study, the biggest study ever undertaken in this area, means that we can say with some statistical certainty that that is a meaningful difference, and this didn't arise just by chance alone. So you can't explain away that result. And the bean counters that work with us on this study, the health economists, tell us that this represents very good value for money compared to the other calls that might be made for the finite healthcare pounds that are allocated within the NHS. So this is really useful for decision makers. So Benjamin Franklin wrote a letter, and that translated into policy about a year later with the establishment of the fire service in the city of Philadelphia, and Philadelphia never burnt down as far as I know. So I'd like to think about what the next steps might be for this study, about how we can translate it into practice and to policy. Don't think we'll do as well as Benjamin Franklin, but we've started putting this out there in the public domain. So a suite of papers that are emerging from this study are now being published in peer-reviewed international journals, and there's an example of one of the papers that we produced from this Yorkshire study for Yorkshire people.